My name is Ellen Schwartz. I'm with the Vermont Workers Center, and I'm going to be co-facilitating tonight with Karen Saunders and Grace Benenson, who are also part of the Vermont Workers Center. And I really thank you all for coming and joining us at the Healthcare Jamboree. Huge thanks to the crew of Workers Center volunteers who've pulled this together, and also to our the folks who've joined us from the Jamboree from other local health-related organizations around the community, who I'll just introduce now, and then they'll introduce themselves a little later and say a little more about who they are, who they're representing. So Don Kierden is here, sitting right back there from the Turning Point Center. We have Kaz and Isaac from Vermont Psychiatric Survivors, Gail from the Inclusion Center, Alicia from SEVCA, the Healthcare Advocate, and Sue Rand, who is at this table. She's standing over there, but she's at this table from the Vermont Department of Health, and we really appreciate all of those folks giving up time to come out to meet with folks in the community and make themselves available. As I said, I'm with the Vermont Workers Center, and we're guided by a vision for the future of Vermont that is based on the idea that all of us as human beings are entitled to live our lives with justice and with dignity. And particularly the campaign, the Healthcare is a Human Right campaign, that when we say human right, I was actually just talking with Isaac about this before, we use 5 human rights principles, so we often are talking about access to healthcare, like all those things like whether you have insurance or don't, whether you have co-pays or deductible, transportation. We're often talking about access, but our human rights principles are really much broader than that. So one of them is universality, which is that everybody should be able to access healthcare and other needed life needs, such as housing and food. I mean, basic human needs, things we all need. So universality, equity is another one, that these things should be shared equitably among us as a community and as a society. Participation is that we all get to participate in decisions about our health and about our lives. Transparency, which is that things should be visible to us. We should know what's going on and they shouldn't be hiding behind curtains. And accountability, which is the idea that, like our healthcare system or our housing system, any of our public systems are accountable to us and not to like profiteers or like faraway sources. So I just wanted to sort of frame a little bit what we mean when we talk about human rights, that it's actually much broader than people often think when they hear terms like, say, single payer, which is really about how healthcare gets paid for. The other thing about our human rights, our campaign for healthcare as a human right, is that we include the rights of healthcare workers as an important piece of the human right to healthcare, and that, for example, that like healthcare workers who don't have safe staffing, who are taking care of too many patients, that's a bad working condition for those workers. It's also bad for patients, because none of us want to be the patient or have our family member be the patient who's cared for by a nurse or a nursing assistant who has too many people to care for, or is being forced to work so many extra hours of overtime that they're exhausted and they, through no fault of their own, might make a mistake just because they're too tired to really be working. So we really think of the rights of healthcare workers right alongside the rights of patients as like inseparable, that we're the rights of those people who provide care for folks in their homes, folks with disabilities or older folks who have home care workers who are coming out to work with them, that those rights are equally as important as the rights of all of us to access healthcare. So we're going to open our program this evening by hearing from 3 community members about their experiences with the healthcare system. And then we're going to watch a brief video, and that's when Karen will take over. And then, we'll have a little discussion after that, and then watch a brief video. And then we'll do a little activity together, and then launch into the part of the evening for taking action and connecting with our community resources. So I'm going to invite Gail Kennedy Haynes to come up, and or you can come up here if you'd like, and then share your story. And Gail's from the Inclusion Center, but she'll speak for herself.
Hi, my name's Gail Kennedy Haynes, and I live here in Brattleboro. Beautiful sunny Brattleboro, great day today now. And I'm a person who I identify as an individual with a number of different disabilities, physical disabilities, medical disabilities, you know, pick a topic, it's falling apart. My goal is to stay upright as long as I can in my life. Don't know how much longer that will be, but today is a good day. When I got involved in the Inclusion Center, it really piqued my interest because it is a nonprofit organization that is run entirely by people who are disabled. And you get to define your disability however you choose to do. Some of us, you know, have physical things, some of us don't. We have a few people in wheelchairs that come regularly. It varies. The Inclusion Center is mostly for social interaction. The reason it was started was because there are too few places for people with varieties of disabilities to come and interact with one another and just enrich our lives by doing things like we play games, we make videos, oftentimes they're on VCTV, they're always on YouTube, look us up, we're ridiculous and you know, we're having a good time. That's what it's all about. So it's free. There is no charge for our services. Our inclusion reaches out anywhere. We all decide on what we're going to do on a given day. We have just started to do what we call the Conversation Cafe, which is one Monday a month. That started when the last presidential election happened, and there were people who were very concerned about what was going to happen in our world. People with disabilities in particular, people with healthcare issues. So we started having these really serious conversations, and that sort of broadened out so that we've tackled things like sexuality, the right for a woman to have access to her own body and control over her own body, and you know, all kinds of things. It varies, again, depending on what people are most interested in. Most recently, we've done death with dignity, things of that nature. Nobody's opinion is more weighted than the other. We all come together with our own opinions, express them in an environment of absolute acceptance. And that's our only strong rule in the confines of Conversation Cafe. You know, you can't step on somebody else's opinion. It's a prototype that I had never encountered anywhere else in the United States that I've lived. So it's really refreshing to have it here in little bitty Brattleboro, where we do so many things that are on the cutting edge. So that's it. I welcome any questions. If people want to drop by, pick up some stuff, we got it. Thank you.
Thank you, Gail. Particular issues for either yourself or other people with disabilities that have to do with the healthcare system that you would like us to be aware of?
Well,
that
yeah.
would be good.
Oh boy. Yes, I've had a terrible time when I moved here. Terrible time finding a doctor, and heck of a time finding a doctor who was sensitive to my disabilities, my issues. Oftentimes, I have had doctors tell me, you know, oh, that couldn't possibly be what's really wrong with you. That kind of thing doesn't happen. I'm pretty darn sure it is, because here I am. So that kind of frustration has led to my being a fairly militant person in terms of I want a physician, I want a dentist, I want people who are my treatment professionals to be professional, to have some knowledge, and if they don't have knowledge of my particular illness or condition, I'm happy to provide it to them. But it seemed to me that too many healthcare providers were not willing to listen to what might be the issue. That was one problem I've had in access to care, and also there are not that many primary care physicians in this area. There's not enough primary care physicians, let alone those that are open to people's differences. So if you're looking for a doctor to, you know, take care of your cookie cutters, then bring them on down, because there are people who will do that, but there are not enough. So one of my missions is to try and get out there in the community and do some education and say, you know, I may not look like it, but, you know, I'm falling apart. Yes?
Yeah, I found out that being on Medicaid, no dentist, except for one dentist in Bellows Falls, will take Medicaid.
Yep.
What are we gonna do about that problem? I mean, that's a big problem right there in
It's a good reason
itself.
for why we're collecting here tonight.
Well, that's another big issue that needs to
And
be
that's
worked
actually
on.
a perfect segue into the next story, because the next person who was gonna speak, and thank you again,
You're welcome.
Phyllis. Give you another name. So the next person who was going to speak tonight is a woman named Laura Austin, and she actually couldn't be here because she had dental work done today, which is sort of a miracle in her life, as you're about to hear, because Karen's gonna read her story.
And that really was the perfect segue into Laura's story, which I have here and I'll read. She wrote,
Okay, good.
I live in Brattleboro and haven't had dental care in over 20 years. My job's insurance carried no dental plan, and just as I've gotten into VHAP, the old Vermont Health Access Plan, dental was excluded. Then I became disabled. With being in a wheelchair, having no car, and living below the poverty line, my options are limited. Add the realities anyone on Medicaid faces. Just finding an accessible dentist in town who'd take a new patient with Medicaid has been nearly impossible. The amount allocated by Medicaid for a total yearly budget is laughable in 2019. But after 20 years of no professional care, my teeth were deteriorating and I had to do something. By chance, I commented about my predicament on a friend's Facebook post about dental care. She offered to pay for an initial visit. That initial visit, which cost her nearly $400 and gave no treatment aside from a cleaning, showed the extent of the work needed. The estimated total for fixing my mouth with nothing cosmetic came to $3,800. At current Medicaid rates, that's about 7 years worth of funds. The dental office I went to does not take Medicaid anyway. So the next issue was raising money. For that, I started a GoFundMe and hit up my friends and family for help. So far, we've raised just under $2,300 out of that $3,800. So I've decided to have an extraction rather than try to save a broken crown and tooth. That'll bring the bill down to the neighborhood of the funds I have. I've had one extraction of infected roots that broke off up in my gum and required a saw and stitches. I have 2 more extractions of broken teeth and several overdue fillings. My doctor thinks my health will greatly improve as I've had a high white blood cell count for a few years now, with the chronic tooth, sinus, and ear infections. Dental health is central to a body's general health. Bad teeth lead to very expensive health problems, costing many thousands of tax dollars. It's all avoidable and just common sense. An ounce of prevention versus a pound of cure. Senator Saunders has brought up this subject many times over the years. We must address this issue and correct this wasteful, unhealthy situation. And that's Laura's story.
Wow.
And it reminds me,
Thank you, Laura.
but it reminds me of some phone calls a lot of us in the Workers Center were making to try to get the amount increased for dental. And that's sort of, we're not quite sure where it's going. It looks like we may have had a little success. But
Yeah, so before Isaac comes up, since Karen mentioned that, there was a bill in the legislature this last term called S-94 that would have increased that $500, slightly over $500 annual dental allowance for people on Medicaid to $1,000 plus 2 preventive visits. It's unclear, like the bill itself is not gonna become a law this year. It didn't do what's called crossing over. The Senate Appropriations has been trying to get some of that money into next year's budget. And I think some of that money is in next year's budget, but it's actually been really hard to sort of parse out, like to read the budget and sort of figure out exactly what's going on, which is why Karen was saying we're not really sure. But hopefully that money will be in there. Just wondering if there's anyone in the group of you who have come today who wanted to say anything about how you're affected by the healthcare system.
I have family members who have struggled to get dental work. It's very, very expensive. People couldn't do it themselves. They need my help. Both dental and medical treatment has been very difficult for some of the lower income people in my family, while their situation got worse and worse in terms of the dental, in terms of other medical situations. So I'm very familiar with the fact that there's not enough health care generally across the board for people, particularly low-income people. If you have a lot of money, I suppose you can get what you want, but people just don't have enough health care. So I'm very familiar with the stories that have been spoken to so far in this meeting, in this group.
Example of someone who the system totally let down and led to major consequences for my life. In like 2013, I had what for Vermont is considered a good job. I was making like $35,000 a year. I owned a house, I had a car, and I had so-called insurance through my workplace that had like a $5,000 or $6,000 deductible. So basically no dental insurance for me, and I couldn't afford dental insurance. When I saved up some money, like I had one of those healthcare accounts, and I saved up $1,200 or $1,400, I would go to the dentist, but that would take me a couple of years to do that. So when I go to the dentist, they'd look at me and they'd say, "Do you want to save your teeth?" And I'd say, "Of course, what a dumb question." No, I want to get rid of my teeth. But what happened was, over the time, the deterioration of my teeth led to my having these severe infections that people are talking about, having a high white blood cell count. And eventually, I had undiagnosed diabetes, and those infections caused my blood sugar to rise very rapidly. And consequently, I had a major stroke and ended up disabled because of that stroke. Lost my house, lost my job, lost all the outward trappings of my life, all the things that I thought were important. So that's essentially why I'm here, because not only am I aware of people in my community who are struggling with the same things, but I have lived this thing for the last 5 years now. That, you know, and even now, they took all my teeth out in 2015 because I basically was in such bad health from these continuing infections that was the only recourse to take. So for the last 4 or 5 years now, I've had no teeth in my mouth, which affects my diet and affects my predisposition for having diabetes. Like I can't really eat a lot of fresh fruit and vegetables because I have nothing to chew them with. And believe me, I have tried, not for lack of wanting or lack of desire to do that, but because I don't have the equipment anymore to do it. So when I hear people telling me about how, you know, dental care is not health care, I have to basically scream, because if people don't take care of their teeth and they can't afford to go to the dentist, they're essentially risking not only their, you know, effect on their being able to eat, their diet and everything else, they're also affecting possibly their heart. If you have a severe infection, it can go to your heart and it can kill you. Or you could have happen what happened to me. You could have a stroke, which, you know, in the outward effects appears to be, you know, like a horrible thing to happen to a person. But because of that stroke, I became involved with Inclusion Center like Gail. And through Inclusion Center, people came from Vermont Workers Center and invited us to come join them. And hearing all the people's healthcare stories at Inclusion Center and everywhere else in the community, when they said healthcare is a human right, I'm ready to join, I'm ready to go for that gung-ho, because it is. And we have to make it so it's not just about, so dentists can go away to the Bahamas every winter and take their families on a nice Disney vacation. There has to be humanity in healthcare, and I hear that from everybody who's speaking, that if there's no humanity in healthcare, it's not healthcare business to us, it's survival to us. So that's why I'm so passionate about becoming part of Vermont Workers Center and marching and talking to people and telling people my story. Never before in my life would I get up in front of a group of people and say anything, not even a word, because I'm like terrified of public speaking. But because of the experience I've had and because of what I see other people going through, I have no choice. It's not an invitation, it's like you're being pulled along. You have to do something, you have to say something. And in Washington, they're debating about whether the Republicans can come up with a health plan to get rid of Obamacare, or whatever you want to call it, Affordable Care Act. What a bunch of liars. They don't care if we all die. So we have to let them know that we're not willing to die for their political expediency. We want to live, and we're going to live, and we're going to speak, and we're going to fight, and we're going to tell them exactly what we need. And until we get what we need, we're not going to shut up ever. That's all I got to say.
Grace, we're with you. So I'm going to turn it over to Karen now, who's going to actually, in a way, it's like this is also a perfect segue into what she's going to share.
Thank you, Grace.
You're welcome.
But, so you're going to hear from Sasha in a minute. And what you're going to hear is the same stuff that's made really clear by everybody who's spoken so far, that although the healthcare system impacts us in such different ways, for all of us, one of the big things is that we're treated as commodities, and our health is treated as a commodity, something for other people to make a profit off of, instead of us being treated as human beings who deserve respect and dignity, the right to be treated with dignity and respect. And that makes a huge difference if we get it in our ability to live a dignified life. Stosh in the first clip, but then we see him taking his story to a public hearing at the Green Mountain Healthcare Board, which is supposed to regulate healthcare for our benefit.
My name is Stosh Blaze, and I'm from East Randolph, Vermont. My problems really started with a blood clot. I went and had a blood test, and because I had a blood clot, they needed to see me once, twice, sometimes 3 times a week, and each time brought a copay with it. After 3 months of this kind of tests and treatment, I fell way behind. This is what I've accumulated just in this year alone. I have to see once every 3 months, but I can't go to the specialist he wants me to go to. I can't go see a specialist for the pain, the chronic pain I'm in. Myself and other folks don't go to specialists because when I go in to see them, I have a Green Mountain Care Card, and this is just 12 months this year's worth of co-pays that I'm never going to be able to pay. So I paid the Woodman $750 in the last couple months, but I'm not going to go have my feet looked at. And I'm willing to put up with the extra pain, but I'm hoping that folks like myself will not get co-paid out of going to a doctor and getting the proper care that they need.
All the people need, all the people need, all the people need health and dignity. All together now in solidarity. All together now in solidarity.
The next bit is a clip from the Medicaid march that was held up in
Introduce yourself to your neighbor if you don't know them yet. So we're marching today because healthcare is a human right.
Healthcare is a human right.
It's going to be leisurely. We're going to dance in the street, all right? Yeah! Healthcare is a human right. Healthcare is a human right. Healthcare is a human right.
Welcome everyone to Barre. I've had the privilege of being the pastor here at the Presbyterian Church for a number of years. And one of the great joys that we have here is that we get to host the Vermont Workers Center and all the good work that they do right here in Barre, which is home to a lot of community organizing and solidarity work over many, many years. A couple VIA folks were traveling in the sunny, warm African country of Morocco. And while they were traveling around Morocco, they learned about a lot of the challenges that folks face in Morocco, things like illiteracy, things like poverty, things that keep people down for too long. And they had a guide whose name was Hamad, who was leading them around Morocco. And as they were face to face with a lot of the poverty in that community, they asked Hamad, what do people do when they need health care? And you know what Hamad said in this developing country? He said that in Morocco, we provide health care for every single citizen of our country.
Well, that's good.
So then Hamad asked my friends, Mary Beth and Tom, if there was universal health care in this country, the United States of America, the wealthiest country in the world. And you know what they answered, right? Is there universal health care? No! Which is a problem.
Yes.
Health care is a
human right.
Health care is a
human right.
Everybody's got a right to live. Everybody's got a right to live. Whole thing.
be silent anymore.
And by the way things are going in this economy for farmers, my situation ain't gonna change anytime soon, so I desperately need Medicaid, and I need way more than Medicaid.
Now, I have a defibrillator, which they stuck in my chest, so I have to be monitored every 3 months. Took me a couple months to get Medicare, so that was kind of, kind of airy. Now, without my Medicaid, I would not be able to have my defibrillator checked every 3 months. And that is the reason why I fight for Medicaid.
Good afternoon, everyone. My name is Hannah. I'm here today marching for Medicaid because working as a healthcare associate here in Barre, for a resource desperately trying to maintain access for reproductive health care. You and I are walking dollar signs to the people that profit off of our current system. And I, for one, refuse to accept that politicians and billionaires have the right to tell me that my life and the lives of the people that I love aren't worth the risk to their profits. All of these reasons and so many more are why I am marching for Medicaid.
My name is Donna. I'm from the Northeast Kingdom. My mother was on Medicaid. She was a bad diabetic, very bad diabetic. Now I have diabetes. It's not quite as bad as hers, but I wouldn't be able to afford my anti-diabetic medication or anything else if it wasn't for Medicaid.
I'm marching for Medicaid because as a single mom of 3 children, working 2 jobs with neither one that provides health insurance. Before the divorce, I received my ex-husband's Cadillac insurance, and without Dr. Dinosaur, I'd never be able to meet my children's healthcare needs. I have a son with ADHD that requires daily medication and monthly doctor visits combined with therapy. My children's right to adequate health care is why I'm marching for Medicaid.
I'm marching for Medicare because coverage is always dropping. I can go to the eye doctor, but they don't help cover eyeglasses. I paid $300 for these. Dental coverage is only $500 a year. Sometimes they'll give you a voucher if you need more, if they have the money. We go without, but all our government officials are totally covered. Are they better than us? No.
Hola, mi nombre es Miguel. Soy trabajador de la industria lechera del estado de Vermont, ayudando a mantener y a sostener la lechería.
Hi everyone, my name is Miguel. I'm a dairy farm worker here in the state of Vermont, helping to maintain the dairy industry and the family brands of ice cream. I'm also part of Migrant Justice. I work on a farm. It's one of the most difficult jobs there are. It's dangerous due to the large and heavy animals because you can get hit by the cows or crushed by the cows. Also, the machinery is very dangerous. If you get distracted, you can easily get into an accident or even lose your life. The chemicals are also very dangerous. You have to be very careful when you handle the chemicals. If a little bit of acid drops on your eye, you can lose your eyesight.
Si el ácido te cae en la vista, puede quedar hasta ciego.
Recently, I was working on the farm when I was pushing cows, and a bull came right up behind me and hit me on the back. I couldn't get up or I couldn't move, so my co-workers helped me to get up and help me move. Right now, I'm recovering from that injury. Something that really helped me was the workers' compensation. It helped me to giving me part of my wages. I was really lucky. My reality without workers' compensation would have been very difficult because I wouldn't have been able to work. That would have affected my family. My family depends on me. Medicaid is really important because if you have an accident outside of work or anyone has an accident outside of work, you will have the medical support. You don't have to pay that much money when you go to see a doctor. This will help me and my fellow co-workers and because instead of spending so much money, I will use that for things that I need. I wouldn't have to choose between my family and my health. It will be great that this law continues to move forward and continues to stay strong so that we all get the medical coverage that we need.
Vermont's NEA Teacher Union is joining the struggle for healthcare for all. As teachers and support staff, we love the young people under our care. Any cuts to Medicaid, small or large, harms our students' learning, which directly impacts our teaching conditions. Teachers and support staff unions must fight for the public good, health care for all, as well as education, housing, and food, because these are the foundations to health. All people deserve health care now. So when health care is under attack, what do? Stand up, fight back. When health care is under attack, what do? Stand up, fight back. Thank you.
I work primarily with involuntary patients at the Brattleboro retreat. Many of the patients staying at the hospital involuntarily were brought in following a stressful incident involving money. Having to choose between basic staples of living, health, and psychiatric care is a tightrope that no one should be forced to walk. But I meet people every day at work who fell off through no fault of their own.
Yeah, my name is Volney, and I'm here to call for the protection and the expansion of Medicaid, not only as a Vermont Workers Center member, but as somebody that's gone through the Medicaid system and experienced the benefits and the shortcomings. I've had a long, lengthy battle with cancer, in which I heavily relied on the Medicaid system, and once I was in it, I realized that it didn't cover most of the things that I would need. My story's not unique, and there are people all over that have to go through the same problems, and I feel like everybody in every state all over America shouldn't have to worry about their health care, and not only for them and themselves and their families, but also the people in their community. So I'm here to call for a protection and expansion of Medicaid, and that's why I'm marching.
I am marching for Medicaid because mental health issues are a big part of universal health care. In order to live a normal life, we need this insurance. So, healthcare is a human right. Everybody say it. Healthcare is a human right.
That's really hard. People getting real vulnerable. This is real stuff we're talking about. People are really suffering. We are really suffering. Our family members, our neighbors, our coworkers are really suffering under this unjust system. And I think our friend Becca here said it best, that profit, that's what's up. That's why things are so bad, because there are so many people trying to make money off of our bodies. And that ain't right. You know, we're at a real crossroads in this country. We can either decide as a nation that we're going to guarantee health care for everyone, guarantee it for everyone regardless of their immigration status, regardless of the color of their skin, their pre-existing conditions, how much money they make, if they were born into the right family and in the right neighborhood, or their gender.
Well, you better believe it's going to take getting beyond human right to health care too, because we're going to fight for our right to housing, to food, to clean air and water and dignified work. We're going to fight for the rights of people who are different than we are, because at the end of the day, what unites us all is that we live in the wealthiest nation in the history of the world. Yet there are so many of us struggling just to get by, while the rich keep getting richer off our backs. 1,500 patients go to this office, to this primary care facility, and at least 150 or 200 walk there. So if it closes and it's the only downtown office, what is going on, folks? Rural hospitals are closing. These primary care places are closing in smaller towns. And then I hear there's some kind of expansion happening in Burlington.
But there's, you know, the important thing is today, this is not the end, right? It's not the beginning. People have been engaged in this fight for a very long time, but it's also not the end. This is not about a single event. This is about a process of organizing a robust, gigantic movement of poor and working class Vermonters who are going to fight for healthcare justice. We're going to fight for migrant justice. We're going to fight for disability rights. We're going to fight for gender justice and reproductive justice. And we're not going to stop until we win it all, right? All right? So what do we say? Forward together, not one step back. Forward together, not one step back. Forward together, not one step back. Forward together, not one step back.
to do an exercise we call the teeter-totter. So teeter-totter is like a seesaw. There's the seesaw. And the seesaw is sort of, it's not level right now. If we think about the world of healthcare, this side of the seesaw is like where all the power lies. So that's why it's down. There's a lot of power holding it down. So if you just think about like the healthcare system as you experience it, and just people can just call out who are some of the forces, we're not really thinking about individuals, but the forces that have a lot of power, that have a lot of control over things like whether we get healthcare or whether we get listened to in the world of healthcare. And people can just call out, and I'll just sort of like stack them up on the teeter-totter.
Insurance companies.
Okay.
Pharmaceutical companies.
That's the big one that needs to be checked.
Healthcare lobby.
Here's the other end of the teeter-totter. So up here, we've got like the people who spoke tonight. So we've got 3 people. We've got Stash up here. And
Grace up there.
Well, I had Grace. She spoke out tonight. We've got like a handful of people here who don't have this kind of money. They don't have this kind of power. So if we look at this, and if our goal is like we're up here, we are not these folks. This is why we don't have the human right to health care. If our goal is to equalize this power, to move this side of the teeter-totter down so that we actually can exercise more power, what is it that we need up here? Given that we need a lot more of us. I'm just going to draw like a bunch of little circles because I'm a terrible artist. But we need a lot more than this. Because we, the people in this room, my guess is, having heard people speak, we are never going to have this kind of money. We're not going to be hiring lobbyists. That's not who we are. It's supposed to be working for us.
Yeah, it's supposed to be us the people, but I don't see that.
And that's why we need a whole lot more of us. The reason it's not happening right now, the reason they're sort of in bed with all these folks, is that it's not that there aren't a lot of us. There are millions of people, like 140 million people in this country right now are poor. There are millions of people who are struggling. The problem is that we're not sort of like working together. We're all sort of going in different directions. We're not understanding how these systems like ableism and saneism and racism are sort of impacted with the whole rest of the system. So we're sort of off in our little separate worlds, and unless we're able to come together, we don't have a chance against those folks. And that's really why, like when Grace was speaking before about like people coming together and her personal experience, and that's why we do things like marching for Medicaid. That's why we do things like contacting legislators and the things we're about to launch into, because unless we can, and that's why we invite all of you to be a part of this, because unless we can do this together, it doesn't mean we all have to agree about everything. We never will all agree about everything. We need a forum where we can talk about our differences of opinion, but unless we can unite across some of our differences of experience and differences of opinion, we don't stand a chance, because look at who we're up against. And this is why we don't have healthcare right now like so many other countries do. We don't have it because this group of forces has been so powerful in making sure that healthcare didn't become a public good. It's, there have been efforts since the 40s to make it into a public good, but it hasn't succeeded because of this. So this is a very simplistic in a certain way. It's like a too quick way of looking at sort of power, but I think it sort of makes the point.
I think about the Women's March in Washington right after the election. Although we can't tie it directly to 2018 congressional elections. It certainly had a powerful visual impact on people that you could get up and say your piece. And while they might not be listening, the rest of us are listening. And we're going to follow suit. We're going to run for office. And we're going to do a lot of things that they haven't seen us do before. We're gonna shout it out, and we're gonna work on it until you make it right. Because if we don't speak for ourselves, who else is going to?
And once again, a perfect segue into something that I was about to say, which is that our partners in the disability rights community have this phrase, nothing about us without us, which is what Grace was just talking about. Like, if we're not the people speaking out about our lives and how we are impacted, nobody else will do it for us. And the other part of nothing about us without us is about participation. That decisions about our lives shouldn't really be made without our participating in those decisions, which is really what Isaac was talking about with coercion, like being coerced into something without being able to participate. If I feel like that's what I heard you say.
Very much so.
And that idea of nothing about us without us is like a really key idea that we gained at the Workers Center from our partnerships with disability rights organizations who coined that great phrase. So,
hi, my name's Don, and I'm a person in recovery from alcohol use disorder. And I'm also a program coordinator for Turning Point in Windham County, which is one of the 12 state-funded recovery centers in Vermont. What's a recovery center, you say? Basically, our mission is to be a safe and welcoming environment for people in recovery from substance use disorder or other process addictions and their families. So what we provide is a safe haven, 9 to 5, Monday through Friday. We're open just as the center, and you can just drop in and see what we have to offer, hang out with us, get a cup of coffee. And then we're open hours outside of that with the various groups and meetings and sorts of things that we offer. I've got some materials here. Our monthly newsletter has the schedule of events. So what is a recovery center? So there's prevention, and that happens in the schools, and that's a proven process. It's an evidence-based practice that helps prevent people from going down the road to substance use disorder. There's the turning point at which you decide you want to be a person in recovery, and sometimes that involves going into treatment, which is a $35 billion a year industry. And then there's the part that happens after that pretty much lasts, if you're lucky, from that moment until one day you breathe out, you don't breathe in again. That's the part that has gotten very little funding. So we run on about, there's 12 centers, we run on about $100,000 a year a piece. Everything that we offer is free. We help people coming from treatment, coming from incarceration, coming from the end of the road where nobody wants them anymore in the family, what have you, and help them reintegrate into society. We partner with 40 some odd entities here in Windham County, everybody from labor people to housing people to health people to recovery coaching. We've got a lot of services to offer. Again, for people seeking recovery and people that have people. It's really hard to find somebody these days that doesn't have somebody they care about who's struggling with this stuff. We know a lot of things. We have lived this experience. I'm fortunate enough to, I just had my half birthday. I've been in recovery for 25 and a half years. It's not that hard to do. It's, okay, maybe it's hard. It's pretty simple. Okay, it's not easy, but here's the important thing you need to know. It's really hard to do it alone, and we got people that are just sitting there waiting for you to come in. So, so swing by sometime, or give us a call, or look us up on Facebook. That's it.
Thanks, Don.
Thanks, Don.
I'm from the dentist. I'm a public health dental hygienist. So the whole focus of my job is access. I'm here representing the Vermont Department of Health, the entire Department of Health, not just the dental piece. So I'm certainly happy to talk to any of you regards dental. I have a list here of offices that do accept Medicaid in the area. You're right, we have Rockingham Dental in Bellows Falls, and we have SD Dental here in Brattleboro. And we have a new practice opening up on the 21st of the month that you've heard about already, Windham County Dental Center. By the way, they like the word center, not clinic. They want to be offering care to everybody. It is developed specifically for people who are low income on Medicaid or no insurance. They will be developing a sliding scale fee. I want you to know, despite the horrendous stories that you hear, that have experienced and live every day, and I get calls on every day, there have been many people working in the community between the town, the hospital, incredible work being done by Carmen Derby at United Way, myself in the health department, our district director who just retired. Amazing organizations, many people, dentists, retired dentists working on this. There's been a lot of people working on this for years. But I've got to say, United Way, quite honestly, took the bull by the horns, and this clinic is opening on the 21st. Hopefully, it's not going to meet all the needs right away. We only have a dentist, Dr. Rule, 2 days a week coming in, but we will have hygiene services 4 days a week. We hope eventually to have another dentist at some point. It's a work in progress. So that's what I can tell you about the dental starting, but I'm really here representing the whole department, so I'll just let you know that one of the things we focus on is really prevention, the idea to get systems out in the community to prevent problems. So one of the things we're promoting a lot is information on ticks, because obviously ticks has become a big problem in Vermont as the climate warms. Another thing we focus on heavily is WIC program, women, infant, children, getting health care, medical attention for pregnant women and then their children through age 4. So there's information on that here. Then I've got the section here on dental. Also, we have a program called 3-4-50, and we work primarily with companies to get them involved in wellness for their employees, because we know here in Vermont that 3 main behaviors, lack of physical activity, poor nutrition, and tobacco, lead to 4 of the major diseases in Vermont, which are heart disease, diabetes, cardiovascular disease, and lung disease and cancer. That's lung disease, diabetes, cardiovascular disease, cancer. Those are the 4. And that leads to 50% of the deaths. So working on a system basis, that's a major focus of the health department, is to address those issues.
I didn't hear opioids in there.
No, you didn't. That's a whole separate issue that's come up, in recent years, and that's we collaborate. The health department collaborates with all the organizations that are here today, as well as many others in the community, and with the Opioid Center and Habit OpCo and Groundworks, and we do have a plethora of services in Brattleboro, Windham County area, and the health department collaborates with all of them. Something that the entire state is working on in the health department very much is not equality for everybody, but equity. So just what you've all been talking about, people start out at various levels, and those who have greater needs, public health has the responsibility and the desire to bring those people up, which is the whole ethos of the workers group, to allow everybody to have equity in order to access services and be able to be healthy.
as DeWolf, I'm the communications coordinator for Vermont Psychiatric Survivors. We are a peer-run mutual support and advocacy, civil rights advocacy organization run by and for psychiatric survivors. We provide patient representatives, which is what Isaac does here in Brattleboro. This is the Brattleboro retreat. Patient representatives visit locked psychiatric units and unlocked residential facilities to provide mutual support and advocacy, so to help patients get their needs met while they're in treatment settings, have informed consent over their and some ability to be heard about what medications they want to take or don't want to take, and also to help address any grievances that might come up in those settings, address patient abuses and mistreatment. And we also do statewide advocacy against coercive and forced treatment practices such as seclusion and restraint, court-ordered psychiatric treatment, orders of non-hospitalization, forced drugging. We oppose those and really advocate for, nothing about us without us, advocate for our rights in negotiating our treatment within the system. We also have some information about our patient representatives, and I have a little zine that I wrote, which is not funded by VPS in any way.
But it's very cool, I just read it.
called What the Fuck is Mad Pride?
This whole teeter-totter thing is really just so significant in my mind because of the inequities that we see all the time and that people who come to the Inclusion Center speak of all the time. How inequitable the system is and how weighted against us the system is. We need to change that. Alicia.
I'm Alicia Moyer, and I'm currently the healthcare navigator for SEVCA, Southeastern Vermont Community Action, which provides a lot of different things, helpful things to people, and weatherization and all sorts of things. But my focus is on helping people with the system as it is to try to get connected with whatever healthcare coverage they can, and to some degree to advocate. I am a certified healthcare navigator with Vermont Health Connect, so a lot of times we'll call into Health Connect and see if there are any workarounds to sort of maneuver through some stuck places that people get themselves into in the system. And just for whatever it's worth, I've been an advocate in various ways for my whole working life. So with elders, with people with disabilities, people with addiction issues, et cetera, et cetera. So I love to connect people with other resources in the area, and I'm very empathic. So I love my job because it's yet another situation where people find themselves trying to maneuver through a system that can be really complicated and not always friendly. So come talk to me more.
And our campaign is really for healthcare for everybody. It isn't only about Medicaid. The reason we're focusing on Medicaid is that Medicaid is particularly under attack right now at the federal level, and then that impacts the state level. And if you look at this, the people on Medicaid by definition are poor. That's how you get on Medicaid. And so these are like people on Medicaid are often like the people who have the least power, and we need the most unity to make sure that Medicaid is not cut back and also is expanded in ways that for things that it doesn't currently cover, or for people who, were like $4 over the limit and suddenly they're not eligible for Medicaid and they have no insurance. So that's what the March for Medicaid is about. It's about Medicaid and healthcare for all. But the Workers Center is also part of the Raise the Wage Coalition, and there is a bill right now in the state legislature to raise the minimum wage to $15 an hour by 2024, which is really pretty modest by, if you're thinking 2024. The legislative session is drawing to an end, so it would be really good to contact them ASAP. There's this little pushback about the minimum wage that has to do with Medicaid, something we're focused on, which has to do with raising a wage for those people who provide direct care services for people, elderly people and people with disabilities. And the pushback is that, well, if we raise the wage, then people on Medicaid are going to get less services because they get a limited amount of money, and if they have to pay more to their provider, they're going to have to cut back on their services. And the position we take at the Workers Center is we need to do both. We need to raise the wage, and we also need to adequately fund Medicaid, because people who need these services should not be pitted against the people who are providing the services. That's a great way of dividing those of us up here. And we need to actually be together, so we need to be advocating for increasing the underfunded Medicaid, but not at the expense of the people who are doing that work, who are going into folks' homes so that those people can live independent lives. So I just wanted to mention that because it's like out there in the airwaves, and your legislator may be hearing about that, and your legislator may be nervous about it. And I think it's really important to give them the message that raising the wage is important, but not at the expense of people with disability. I'm gonna thank you all for coming, and I'm just gonna let people just get up and cruise the different tables you've heard about, sign up for the march, whatever you want to do, and thank you very much. Thanks, Ellen.